Effective tips to prevent breast cancer for women. Cancer of the breast. Simply reading those phrases can cause plenty of women to feel anxious. This is quite normal. Nearly everyone is familiar with someone who has lived with the condition. These days, however, there is a great deal of positive information regarding breast cancer. Treatments are continually being improved, and we are more knowledgeable than ever before about strategies to avoid contracting the disease. The risk of developing breast cancer can be reduced by taking these 8 actions, even though not every single one of them applies to every single woman. The majority of women will be able to take some actions to improve the health of their breasts. In addition, even a single adjustment can result in positive outcomes. Number 1. Pay attention to your weight. Because it is so frequently mentioned, it is simple to ignore the fact that achieving and maintaining a healthy weight is a goal that should be prioritized by everyone. For women who have gone through menopause, being overweight can significantly raise the likelihood of developing breast cancer, as well as several other malignancies. Number 2. Engage in some form of physical activity. The best thing you can do for your health is to engage in regular physical activity. It has the potential to improve both mood and energy levels. It has the potential to control one's weight. It is also possible for it to reduce the chance of a wide variety of dangerous diseases, including breast cancer. To receive at least 30 minutes of physical activity every day, but any quantity of physical activity is preferable to none at all. Number 3. Consume plenty of fruits and vegetables, and try to limit your alcohol consumption. 0 is the best. A nutritious diet can assist in reducing the likelihood of developing breast cancer. Eat a lot of fruits and vegetables, and try to limit the amount of alcohol you consume. Consuming alcohol, even in small amounts, can raise the likelihood of developing breast cancer. In addition, given the other dangers associated with alcohol, abstaining from drinking is the most prudent choice in terms of overall health. Number 4. Refrain from smoking. Among the numerous other dangers to one's health, smoking is responsible for the development of at least 15 distinct malignancies, one of which is breast cancer. Make every effort to give up smoking as soon as you possibly can. In almost all cases, it is never too late to receive benefits. You are capable of doing it. Additionally, seeking assistance might increase your chances of quitting smoking for good. Number 5. Breastfeed if at all possible. The chance of developing breast cancer is reduced when a mother breastfeeds her kid for a cumulative period of 1 year or longer for all children. Additionally, it offers significant advantages to the child's health. Get in touch with your pediatrician, the hospital, or the local health department if you need any information or support on breastfeeding. You should steer clear of birth control pills, especially after the age of 35 or if you are a smoker. Number 6. Taking birth control tablets can have both positive and negative effects. When it comes to women, the risks are lesser when they are younger. Women who are taking birth control tablets have a marginally elevated chance of developing breast cancer during their contraceptive use. Once you stop using the tablet, this risk will disappear almost immediately. In addition, the chance of having a stroke or a heart attack is increased when using the pill, and this is especially true for women who smoke. Long-term use, on the other hand, may also have significant advantages, such as a reduction in the likelihood of developing ovarian cancer, colon cancer, and uterine cancer, not to mention the possibility of avoiding unintended pregnancy. Therefore, several things work in its favor. Avoiding birth control tablets is one way to reduce the risk of developing breast cancer, particularly if you are highly concerned about the disease. 7th, steer clear of hormone therapy for menopause. Hormone therapy for menopause should not be given for an extended period to prevent chronic disorders. It has been shown in studies to have a contradictory impact on health, since it raises the risk of certain diseases while simultaneously lowering the risk of others. The risk of breast cancer is increased by hormones that include estrogen alone, as well as hormones that contain estrogen in addition to progestin. It is recommended that women who do want to undergo menopausal hormone therapy do so for the least amount of time possible. If you want to discuss the potential drawbacks and advantages of menopausal hormone therapy, your physician is the ideal person to talk to. Treatment with tamoxifen and raloxifene for women who are at a high risk. Taking the prescription medications tamoxifen and raloxifene can greatly reduce the incidence of breast cancer in women who are at a high risk of developing the disease. This is even though these medications are not typically considered to be healthy behaviors. These potent medications, which have been approved by the FDA for the prevention of breast cancer, may cause adverse effects, which means that they are not suitable for everyone. Discuss the possibility of taking tamoxifen or raloxifene with your physician if you believe that you are at high risk for developing breast cancer. Learn about the history of your family. Women who have a strong family history of cancer can take additional precautions to reduce or minimize their risk. If you have a mother or sister who has got breast or ovarian cancer, especially at a young age, or if you have many family members, including men who have developed breast, ovarian, or prostate cancer, you may be at a high risk of developing breast cancer. A genetic counselor or a physician can assist you in comprehending the history of the disease in your family. You should not ignore mammograms. Mammograms, which are used for breast cancer screening, can save lives. Unfortunately, it does not help prevent cancer, but it can assist in the early detection of cancer when it is more curable. Beginning around the age of 40, the majority of women should begin regular mammograms. Mammograms may need to be started earlier for women who are at a higher risk of developing breast cancer. If you are above the age of 30, it is recommended that you consult a medical professional about any breast cancer risk factors you may have and whether or not you may benefit from earlier screening. For screening purposes, it is not recommended to perform breast self-exams regularly. The benefits that they provide have not been discovered. However, it is important that you are familiar with your breasts and that you inform a healthcare physician as soon as possible if you observe any changes in the way that your breasts appear or feel. Is there a connection between the use of birth control pills and the development of breast cancer? The use of hormonal methods of birth control has been linked to an increased risk of breast cancer, according to some data. Pills used for birth control and intrauterine devices, IUDs that release hormones, are examples of these. The danger, however, is low. Not only that, but it decreases as you quit using chemical birth control. Discuss the many methods of birth control that are available to you with a member of your medical team. To help you assess the benefits and dangers, your healthcare provider can assist. These are some of the advantages of using birth control pills. Menstrual bleeding was brought under control, preventing pregnancy that is not desired. By reducing the likelihood of developing other types of cancer, including endometrial cancer and ovarian cancer. What else am I able to do? It is imperative that you immediately inform a member of your healthcare team if you observe any changes in the appearance or sensation of your breasts. For instance, if you see changes in your skin or if you feel a new lump, you should obtain a checkup. You should also inquire with your healthcare provider about the appropriate time to begin mammography and other screening tests, depending on your particular medical history. There is an increased likelihood of breast cancer in certain individuals. Several factors may contribute to this, including having a family history of the disease or having certain gene mutations. You may be encouraged to take actions such as genetic counseling and testing if your healthcare practitioner informs you that your risk is higher. Exams of the breasts more frequently. Early breast cancer screenings are recommended for women of all ages. Medications or surgical procedures to prevent breast cancer. So this is the end of our today's video. Do you like it? Kindly give your valuable response in our comment section below. And don't forget to subscribe to our YouTube channel for more interesting and informative videos.